With doctors planning unprecedented industrial action next week, Perspective this week is giving you a chance to hear from the doctors.
My name is Sean Crerand. I'm one of the orthopaedic consultants in the hospital. I've been here since 1996. My present role is a member of the LNC, which is the local negotiating committee of the BMA, and I'm also this year's president of the Isle of Man Medical Society.
I'm Prakash Tyagarajan. I'm a consultant pediatrician and neonatologist. I have been in the Isle of Man since 2005, and my role is as a member of the local negotiating committee of the BMA and also the chairperson of the Isle of Man Medical Society.
Okay, so there's been quite a big announcement this week. What is effectively the announcement? What are you proposing to do?
We are planning to take initial industrial action by providing emergency care cover only for 2 days next week. That will be the Wednesday and the Thursday. None of us want to do this. None of us want to get here. And if it goes ahead, it'll be the first time doctors in the Isle of Man have taken anything like an industrial action. I believe the last time Manx doctors came close to taking industrial action was in 1957, and they averted any industrial action at that time.
And, well, presumably something has happened to get you to this position. I mean, obviously there was a vote that took place over the first 2 or 3 weeks of December, and ultimately that vote was very much in favour of taking industrial action. I mean, in relation to that vote, I mean, what sort of figures were we talking about in terms of doctors in favour?
Well, we've had an excellent turnout of the doctors, and the depth of feeling was indicated by the turnout and the vote in favour of industrial action, when more than 95% of the doctors who voted in favour of industrial action. Obviously, that reflects the degree of frustration, really, that is obvious among the medical staff in the hospital.
And it's not all doctors, this, is it? There are going to be some doctors who will still be working. Now, how does that work?
It's what we call a Christmas Day cover, loosely. And essentially what it means is minimum safe staffing. We will have to agree with each department what is considered minimum safe staffing. In other words, there should be sufficient number of doctors to cope with emergencies. And if you can look at how many doctors were on the floor on Christmas Day, it's very similar to that.
So any patients expecting turkey and crackers from the Christmas Day service, that's not quite what you mean. But the other doctors, I mean, there are other doctors in the island, GPs, some of whom will be impacted by this, others won't.
Those doctors who are directly employed by Manx Care will take part in this industrial action, but that's only a handful of them. Other general practitioners who are independent contractors providing a service won't be impacted by this.
Okay. So I suppose the obvious then next question is how do we get to this position? I mean, you say that this is the first time that it's even been contemplated for more than half a century. How have we got to this position?
Well, just as an example, at the moment we're negotiating the 2023-2024 salary increases, and this has been going on so more than a year, in fact more than 18 months. And we felt that we really weren't making any progress whatsoever. And because of that, we felt that we had to try and push negotiations forward, and the only way we seem to be able to do that was this threat, and it is a threat at the moment of industrial action. And it reflects, as I said earlier, the frustration among the medical staff that no progress seems to have been made over that period of time.
Doctors are generally, compared with most people in society, quite well paid. And there will be people listening to this programme who will say, well, actually, there's a cost of living crisis going on here. We've got significant problems in terms of funding Manx Care. Most people have had quite miserly increases for a decade or more in terms of their salaries. Why should the doctors be able to get the sort of paid rises you're talking about, 12.5%, something like that?
Right. What we are fighting for is what the BMA calls pay restoration. Essentially restore pay in real terms to pre-Tory austerity in the UK. And if you look at how various professional groups have fared, the doctors, hospital doctors in particular, and even amongst the hospital doctors, consultants and resident doctors or junior doctors have been the worst affected. Following year after year after year of below inflation pay raises, we are now 20% behind what we were back in 2008. And if you look at the general population from the Office of National Statistics, all other workers, public and private sector, if you put them together, are 1.2% up on what they were earning back in 2008, whereas we are 20% below. And prior to Manx Care, what used to happen was we used to have pay rounds every year. However, the DHSE's initial offer would always be what NHS England offered. And rarely we managed to improve on that. Mostly we just accepted what they did. But since the advent of Manx Care, all our initial offers, one, didn't materialize for several months after the implementation date, and two, were way below NHS England offers. Like, for example, for 2023, the consultants and staff grade doctors in England got around 11.25%, whereas the previously known as junior doctors, currently known as resident doctors, they got 11%. They basically actually got 11% plus 11%, so 22% over 2 years, whereas the more permanent type doctors got 11.25% for 2023 and 6% for 24. And we've been offered only 6% for 2023, and now very recently we actually got a formal offer of 4% for 2024. We're just far too far apart.
So in terms of the negotiation that you've been having and the discussion that's been had so far, I mean, obviously Manx Care will be invited to give their take on all of this, but why has Manx Care, or has Manx Care indeed told you anything as to why they have chosen to offer substantially less of an increase than the UK doctors appear to be getting?
I think it reflects the current financial situation within Manx Care. For whatever reason, they have quite a significant budget deficit, and I think that in fairness to them, they're going to obviously try to make as much savings as possible, and because of that they find that trying to match, never mind increase, the amount of money that has been offered to our colleagues across in the UK is difficult for them. There is no doubt about that. But the problem is that it's more a question of almost intransigence, really, until we actually began to ballot our members and to discuss the possibility even of industrial action. So I think it's obviously a negotiating ploy as well. You know, we have proved that the medical salaries don't account for an enormous amount, an enormous percentage of the expenditure in Manx Care. We've pointed out areas where they can make savings and so on. So we've been proactive with them during this period, and it's only then when we've begun to get slightly frustrated and threatened that we've actually had quite recently, meaningful negotiations with them.
So presumably since the announcement, which was just before Christmas, there's been would you describe it as a flurry of activity or just a more focused amount of discussion?
I would say we actually having proper negotiations, that give and take, which we haven't had for the past 4 years until we held the ballot and MERS got involved. So we're actually pleased that finally we're actually having a negotiation.
And MERS is Manx Industrial Relations Service. Yes. Yeah. So it sounds then as though at least discussions appear to be taking place and they appear to be meaningful. Would it not be possible or reasonable for you to say, well, actually, we'll delay this action for a couple of weeks whilst those discussions carry on to avoid the inevitable impact on people who use the services at the hospital?
We were sincerely hoping to do that. We just want something tangible that will be acceptable to all our members. And although we have made progress towards something like that, we are too far away, however much we want. Plus also, I believe, according to Manx law, we have to announce the very first day of industrial action within 5 weeks of announcing the results of the ballot.
Right.
So the clock is ticking, and 27th is the latest we can take industrial action. Except we could apparently ask for 1 week's extension via MERS. So, as the clock is ticking, we really have to commence industrial action. But it's already beginning to work in that we're having proper negotiations as opposed to being told this is what you're getting.
Okay. And I think we have to give credit to MERS, actually the Industrial Relations Service. They have been very good, and they have come up with certain solutions and so on. But as Prakash was saying, we have a mandate to follow, and there are certain time limitations on that. Nevertheless, if we do get certainly a tangible offer that we can put to the members, then we will be in a position to possibly postpone.
Okay. Yeah. Does having, in the latest calculation, I had 4 ministers working on health-related topics. You've got the Chief Minister who's seeing this as the most important issue that he can focus his time on. You've got a new Health Minister. You've got 2 ministers, David Ashford and I forget who was the other now, but 2 ministers are also members of the Department of Health and Social Care. So you've got an awful lot of ministers in there. Is that helping or hindering the process?
I think it's helping, and I think it reflects how seriously the ministers and the members of Tynwald take the provision of healthcare on the island. It's an extremely important, the health of the island's population is extremely important for not only the present population but the population in the future. And I think that having more than one person deal with what is a momentous problem at the moment is to be applauded, really. I think the more people that are working on it, the more solutions that may be available, the more people one can bounce their ideas off and so on. I would certainly be all in favour of that, and I wouldn't say that it's excessive at all, in fact, given the degree of difficulty the health service is in at the moment. And I think that the health minister certainly will take it upon herself to try and come up with some solutions and some help. And the chief minister certainly, I think, has taken it on board. The importance of having a stable health service for the island and a stable workforce in the health service, and the ability to attract and retain people, doctors, professionals to the island. So yes, I agree. I think it's useful. Yeah.
I mean, at this stage, it is a threat, but inevitably, there will be people who will have their appointments, procedures cancelled, and I'm guessing that action in relation to that will have to be happening this week. So even if at a very late stage you're able to sort of reach some level of agreement so the industrial action doesn't have to take place, there are people who are going to end up having their appointments cancelled, having their procedures cancelled. Some people will be getting towards the end of their tether in relation to, particularly your area, Sean, which is the orthopaedic side. People with really dodgy hips and knees and in some degree of pain, significant degree of pain. They'll be really frustrated. I mean, what would you say to them when they are facing the effectively further delays in relation to their treatment?
I think people are already frustrated at the delivery of service, the cancellation without any industrial action whatsoever. Elective surgery has been cancelled, has been postponed, clinics have been cancelled and postponed. So we don't want to take it, our industrial action, and we feel that if we do get a credible offer in the immediate future, and people are working, our own representatives are working this evening as we talk, tomorrow morning as we talk, to present Manx Care with solutions to the problem with a credible offer, that this whole action can be delayed. And certainly we are our patients' advocates. We want to provide a good service to them, and I think in the longer term, having a stable workforce, being able to attract people, being able to fill the vacancies that are causing some of these delays will, in the longer term, actually be helpful to patients and helpful to deliver a service to them.
And I should say we're recording this on the Tuesday evening. The programme will of course be, or is now being broadcast on Sunday at 12. But so there are still opportunities for big things to happen in the course of that time.
Yeah, it's no exaggeration to say that we're working night and day to try and avert this action. Yeah.
But this possibly is a symptom of a much deeper problem, isn't it, in relation to funding and healthcare, and possibly breakthroughs in medical science and the expense that comes with those. Is this a solvable problem, or are we going to have similar problems in terms of funding for healthcare for decades to come?
Obviously, how much do you fund healthcare by? That's a difficult question. Most countries use percentage of GDP, and 7% is kind of the median, and that would be very reasonable. However, the funding that is given now is at spent most wisely and most appropriately? We're not entirely sure. For example, the entire medical wage bill is 40 million. And I understand the difference between the previous year's budget and the 23-24 financial year's budget. Difference was 47 million. So if Manx Care were to spend the entire amount on doctors, we would all had our salaries doubled. Instead, we've got zero increase. So I would say, I'm biased. The fundamental function of a health system is to facilitate the doctor-patient interactions. So eventually, any health system has to be, and in fact we want Manx Care to be, patient-centered, doctor-led, nurse and allied health professionals supported, and management facilitated. I don't think we've got that order right at the moment.
So how then do you think that's not working? What are the elements that you would like to see changed, or is that asking you to go a bit far in this discussion?
With my medical society hat on, we did actually come up. Obviously, unlike the previous reviewers, we didn't charge the Manx government £1 million. We charged nothing. It was just a group of doctors sitting with coffee. And we have come up with an alternative plan, which is published on the Society's website. Obviously, it's not perfect. None of us is an expert in health systems, but which we put together a plan that we believe would best serve the Manx people. And coming back to the pay, we don't want to attract what we call fly-by-nighters and locums. We want to attract colleagues who would come, settle down on the island, be part of the island community. And when we take decisions, it's our own families that get affected. But we're not quite seeing that with Manx Care board, for example. How many of the board members, wonderful people though they are actually resident on the island?
True. Yeah. I don't really have much more to add to what Prakash has just said. And I think as he did say, we did sit down. Indeed, Prakash has probably been the driving force in this and come up with an alternative way of managing the healthcare system, or the hospital provision of healthcare in the hospital, and again to make it more medically led, really, and management facilitated rather than the other way around. And I think you must remember, what is the function of the hospital? The function of the hospital is to provide care, be that medical care or surgical care, for the patients. And the people who are providing that care are the nurses, the doctors, the physiotherapists, the secretaries, and so on. And they are the people who have to be facilitated to do that, not to be overmanaged, not to be taken, and their expertise must be taken into account. They must be listened to. They must be empowered. I've been here almost 30 years. I have ideas of how things should be done, and we must be not be dictated to, but actually have it rather than, as one of my colleagues said, an oligarchy, more have it as a democracy, really. And I think that would help to get the workforce, all of the workforce, not only the medical workforce, but all of the workforce engaged, because as Prakash will tell you in a few moments about the survey that we did recently, that engagement does not seem to be happening. And as a result, we feel that there are elements of maybe waste, maybe elements where things could be improved, streamlined, but not to tackle the actual provision of service as the first thing that has to be cleaved off as a matter of savings.
And I can sort of see, I very much see the point that you're making, but there is also the other side of this, the coin, that actually administrators are really good at administration. Doctors are really good at treating illness and hopefully creating wellness, if that's a thing. Perhaps whilst doctors should be involved in the leadership, there's also a key role to be played there by administrators who know how to run things and to run things efficiently.
Yeah, so it picks up your point. Do you want to be administered or do you want to be treated?
Yeah.
Right, okay. But you could be both, couldn't you?
You could be both, but exactly. But the balance, it is a fine balance, and we probably feel that maybe one side of the equation is a little bit top heavy. Yeah.
You should be in the diplomatic service, I think, because you're being you're gently suggesting, and maybe I'm putting words into your mouth here, that Manx Care isn't listening as to doctors and is taking decisions without the support of doctors. Is that putting it too strongly?
Well, it's not a personal opinion. I think that's the opinion that came out quite forcibly when we did the barometer of care survey, and that was across the board. Really, we got a very good response to that survey. So, as I say, it's not my opinion or Prakash's opinion. It's a widespread opinion that there is a disengagement between those who are, as you said, ministering us, and we ourselves, who are actually the ones who are providing the service for the treating the Manx population.
And Prakash, you've got a bit more information on that survey, have you?
Yes, this is the Culture of Care Barometer survey, jointly designed by King's College London and NHS England, which we've been administering to our members for the past 3 years. And unfortunately, every parameter except the teamwork has progressively got worse and worse and worse. And people feel that things are being done to them as opposed to being part of the team that decides. And the earlier point you were asking about administrators administrating and doctors doctoring. There is very good published evidence, admittedly mostly from North America, that doctor-led organizations, they call them physician-led organizations, are safer, lead to better patient satisfaction, and most importantly, more cost-effective. There's published evidence.
Manx Care obviously was set up to solve a really difficult problem. Are you giving them long enough, would you say? I mean, is it 3 years now that they've been trying to solve these problems? Is there not an inevitability that there are going to be some teething problems and a degree of alienation as a new broom comes in and tries to change things? Is some of this just a kickback that actually you've become too Manx and you don't like change?
I wish that were the case. There are objective measures such as staff engagement, financial prudence, and other things I'd rather not stray into. Objective measures of performance have significantly deteriorated since the advent of Manx Care. And again, there's published evidence that any major structural reorganization will have teething problems. They always sort of talk about this graph where there's an initial downward trend and then an upswing. But the downward trend should stop within a year, and it hasn't.
Okay. In terms of optimism and looking to the future, effectively the alternative model that you've suggested, does that come in within budget, or is the alternative model a more expensive variant to what we've got?
there will be some pump priming budget involved. However, in the medium to long term, it will definitely come under budget. But it will take a very bold decision by the politicians, because we've tried various management structures year after year after year. I'm old enough to remember the Beeman's Review, for example. Maybe it's time to give medical leaders, leaders a chance.
And that in itself, I guess people listening to this programme would be quite shocked to hear you say that, to actually give medical leaders a chance. Because surely to goodness, in all of these investigations and reports and considerations, that must have been something that was suggested and considered.
Manx Care says that it is medically led, but it is led by doctors of their choice. What we need is a team that has a full confidence of the frontline workers. Like, for example, Sean was saying in Ireland, the medical director is elected from amongst the doctors, not anointed by the board.
But then, again, you could argue that you will have a vested interest in choosing someone who's most likely to do the things that fit in with what you want and need, and maybe less likely to do things that may be uncomfortable for doctors but possibly needed doing.
I would beg to differ. Doctors actually want the best for their patients, and they are subject matter experts. And what they don't like is having things done to them. As you know, leading doctors has been described as trying to herd cats. But the fact that we've got this much unity, we've actually got Manx Care to thank. Mm. And every day, I get calls and messages of waste that goes on unchecked. This is the sort of, we are also taxpayers, as you know what I mean. And we want the best for the Manx people, because we are Manx people. Our families are here. And it's not as if that we work here Monday to Thursday and travel back on EasyJet for the weekend. We're not like that. And that's not the kind of person we want to attract. I regard the pay dispute as a distraction. What we need is us to work together. I was trying to tell my colleagues, 2025 will go down in history as a pivotal year when doctors, politicians, and the patients came together, rescued and reformed Manx Care from itself.
And an alternative view could be that 2025 was the year in which a scab was picked, an open wound was created, and I guess if I was a senior leader in Manx Care, the very last thing I would be wanting would be effectively the doctors picking a fight with me, and I would probably feel quite aggrieved by that. So how do you get back to the position of working collaboratively or working, not only getting back to, but moving to the position that you're looking to create, with doctors more involved in the whole leadership, bearing in mind that the team that you're needing to make these sorts of decisions will probably be feeling a bit miffed at the way the doctors have gone about things over the last month or two.
We try our best to take personalities out of it. And I don't think anybody in leadership management positions, Manx Care, is a bad person. What we criticize is some of their decisions. Does it make sense? Mm. And we're really looking forward to working in collaboration. And at the end of the day, our job, the reason that we exist, is to provide good healthcare. And that's the business we should be focusing on. And The only difference of opinion is around how best to structure that. Because we're both on the same team. That's what we want to do. And the sooner we all realize that, and the sooner we can start working together as partners rather than being dictated to, the better for all of us and the Manx public.
I mean, it's quite shocking to hear that after more than a decade, probably a decade and a half of really difficult financial circumstances, that people are coming forward to you and describing examples of waste in the system. I mean, presumably these aren't examples of significant waste in the system, are they? Or
well, there are examples of waste in the system, certainly, and what we have done is we have flagged these up to our senior management, and in the hope that our opinions would be taken into account, these obvious areas of waste would be tackled, but unfortunately that doesn't seem to be the case. And to probably use maybe too strong a word, there is an element of maybe cronyism that might be in the structure of it, and that is what I think has frustrated a lot of our colleagues, and we thought, from a point of being disengaged with the management now, as Prakash was saying, the cats have actually all been herded, because they feel that unless something is done, we will not have a viable health service. We will not have a health service that is economical, and if you can use the term economical at all in provision of a health service. And having a medically led health service, as Prakash was saying, has been proven to be more efficient, safer, and more able to deliver the type of health care that the people, the Manx population, really want. And that's what we're trying to do. But the problem that we have at the moment is that for the last almost 2 years, all our interactions, certainly a vast majority of our interactions with Manx Care, have been dealing with the issue of pay. And had this been solved 18 months ago, 20 months ago, we would then be able to sit down with them and talk about other things, more important things one can say, in the provision of care for the patients. But at the moment, we want to get this solved, out of the way, and then to be able to sit down with our administrators, if you like, and discuss with them in a collegiate way of how to actually deal with the crisis. And it is a crisis at the moment that we have in our own healthcare provision.
I'm guessing when the board members of Manx Care were appointed, they would have been appointed because of some level of experience or expertise in running health care services. How is it then that they seem to be so far away from where you are in terms of their thinking?
I think that the board really doesn't sort of interact, if you like, on a day-to-day basis with us. There obviously is a hierarchy, and one would expect that the decisions of the board would be communicated down along the line. But we don't seem to have any input to that. And there is a vast reservoir of very experienced clinicians, in other words, surgeons and medical doctors in the hospital, who could give that input to the board, but yet that isn't being tapped. That resource isn't being tapped. And that's why we think that we need, as Prakash was saying earlier, we need more medical input because we know what patients want. We know what we want. We know how to provide it. I've been providing it since 1983 when I qualified. So that is a resource that should be used, and it's a resource that is available at no cost at all. We don't need another review or another very, very expensive crowd of people to come across from the UK or wherever to tell us the bleeding obvious. But yet, I think maybe when this current dispute is over, I am hoping that we will be able to then sit down as mature, experienced professionals and deal with the problems that we have.
I'm guessing that most people listening to this programme will be assuming that Manx Care Board will have medical representation of some kind on it. Is that the case?
As far as I'm aware, the Executive Medical Director sits on the board and one of the GPs sits on the board. Again, it's sort of a matter of how they are decided, how they interact with the frontline clinicians, and whether there's a two-way information flow. Those are the things that we need to look at. And I mean, although our dispute is primarily about pay, I don't think this many colleagues would have voted for industrial action if they were satisfied and fulfilled in other ways, if they feel that they are part of the team, rather than being someone who's being dictated to. I don't think there would have been this overwhelming vote for industrial action. I think the pay dispute was probably the last straw that broke the camel's back.
Unfortunately, though, pay is very much at the heart of this particular dispute. And I say unfortunately because there will be plenty of people in the Isle of Man who'll say, well, those blooming doctors, they're earning a fortune as it is. Why do they need these substantial pay increases? And actually, you will be judged by the court of public opinion on the fact that you are having a pay dispute, not having a dispute about the way in which Manx Care is run.
I fully agree, but I would again ask the people, repeat a quote from long time ago. If you think highly qualified professionals are expensive, try employing unqualified professionals. And we are actually thinking the long term here. We really want to attract the best in the business because the Isle of Man's challenges are unique. For example, most UK hospitals our size won't even have a neonatal unit because you get in an ambulance within half an hour to 1 hour, you're in a huge tertiary unit. We could be fog-bound for up to 3 days where we can't get an extremely premature baby off to a tertiary unit. And we have to be able to cope with that. So what you want to attract is not an average doctor, an average consultant, but the best in the business who can think on their feet and cope. And with that, there will be a premium. Why would I want, for example, if I was working in Liverpool Women's Hospital, neonatal unit, and I have a complex neonatal problem, I have 12 other doctors to sort of bounce ideas with, come and have a look at my baby. Here I'm on my own. And you have to have had that level of experience. Therefore, really, I don't think our jobs are suitable for newly qualified consultants even.
Do you think sometimes we spend too long looking at what the UK does, bearing in mind very much the circumstances you've just described, where we have, by necessity, we have to have specialists which a population of our size in the UK just wouldn't have. Do we need to be sometimes, though, looking a bit further afield, looking to remoter parts of the world, looking to islands, like of Iceland and places like this, where they have similar, probably bigger problems than we have in relation to accessing expertise in specialist-based units? Do we do enough of that looking?
Probably not. We did start looking at New Zealand, for example, and then something happened and that was aborted. Yes, we have a lot to learn from smaller jurisdictions, such as even the Republic of Ireland, Jersey, Guernsey, etc., and further afield. And obviously they have things to learn from us also. You might be impressed because before the Lucy Letby matter came to light, Countess of Chester Hospital was noted to have much higher than normal deaths amongst babies. And touch wood, in the same period, our unit had the least deaths. So they actually sent a team of doctors and nurses and managers to come and look at our unit to see what we were doing right.
And I think to pick up on your point, you're absolutely right in the sense that working on the island has unique challenges from the provision of healthcare. And I think far too often what we have done is that we have engaged professionals, if you like, from the UK who have tried to impose the UK system of medical care, either cut and pasted something from a trust in the UK, which doesn't really suit the island, or come with a very negative attitude saying, well, we can't really provide medical care here on the island, so we've got to ship everything off. Rather than looking at the expertise that we have on the island and saying, what do you need? What should we be doing? How can we provide that service, rather than engage in, as I say, a very, no doubt, expensive yet another review who will come and come with ideas from the NHS, come with local ideas from the NHS and say this is how it should be done. And it's completely, and I think possibly if one delves into the origins of Manx Care, that could be an element that maybe the system that was proposed and accepted was not really suitable for the island, and that's why we are in the quagmire that we're in at the moment.
Well, we're almost out of time. We've got a couple of minutes left. What do you hope will happen over the course of the next week or two?
A Christmas miracle, as I told Manx Radio earlier. I think we're still kind of in the Christmas season. What we're hoping for is a credible offer that will be acceptable to all our members.
And then throughout the time that follows that, the next few months, once this dispute is settled, whether that's within the next few days, few weeks, or few months, hopefully it will be settled one way or another. How do you envisage the Manx Care or the Manx Health Service, perhaps in maybe 5 years' time? What's it going to look like?
I'd say in the immediate, as you say, within the next few months after this dispute is settled, one would love another Christmas miracle, and that is insight from our administrators into the amazing pool of talent that is available at their fingertips, if only they would take the attitude that we are working together. We want to work together. Our children will be here. Our mothers, fathers, grandfathers. They're the people that we want to treat and have to treat. And so therefore, it's in our interest, as much as it is in the interests of everyone else living on the island, to have the best possible provision of healthcare. Why not use the hundreds of years probably of experience that's available to them and engage with us? We're not the enemy. We are willing to help, and that's what I would like to see in the shorter term, and then work on that for the longer term.
That was Doctors Crerand and Thea Garagian. Do they have a reasonable case? I'm Phil Gawne. Go to my house and gaze check rum. Thanks for listening.